So if you have any questions, or I can reply.
How many muscles would you needle in one session? So when you had that person that had the bicep, the wrist, do you do all of them in one session, or do you try to break things up and then try to work on?
Yeah, I think that this is a very good question, because it's possible to reply in very different ways. So if you're a clinical physio, it depends on the objective of your treatment. So depending on what kind of objectives you have for that session, you can say, okay, I'm going to treat this or this or this muscle. But there is another important thing to consider, and it's, the patient can stand the pain. Is it painful for the patient? Because I have had some patients that are experiencing pain, so they say, okay, I let you do 2 times, 2 muscles, 3 if I convince them, but they don't like it. So they say, oh, it's good for me, but just a little, only 2 or 3. So the important thing here is to try to prioritize which of the muscles are more dysfunctional or are more dysfunction generators. So we know, due to our experience, that, for example, some muscle like adductor pollicis is influencing a lot. So sometimes this could be a good option because it modulates others. But I have had a lot of patients standing a lot of punctures because they don't feel anything at all. So in some patients I can need 15 muscles because I do like a chain, a lot of things. So not a long time in the same point, so just getting some local twist responses and decreasing the activity for the whole pattern. So it depends a lot on every patient, I think. Which one? Oh no, this is just an example of this one.
No, 2 after this.
Ah, yeah.
The follow-up, so the improvement goes up, right?
Yeah.
If we have displacement, meaning the range of motion.
No, I'm going to explain this technology. What they do is they put a sonda, I don't know, sonda, the name, it's a sensor. They put a sensor, so when you activate the technology, the tensiomyography, it gives a current to the muscle contracts, and the sensor measures the radial displacement of this local muscle just here. So what it says, it has been used in sports to say that if a muscle is contracted or a muscle is weak. So this is the first study we are doing in dry needling for spasticity. So we use this equipment to say, okay, I'm going to put a current here, the muscle is going to contract, so I'm going to measure the radial displacement of these local fibers under the sensor. So if they increase the displacement, I will correlate with a relaxation of the local muscle, but it doesn't have anything to do with the range of movement. We just measure with this equipment, the tensiomyography, the contractile properties of the muscle.
Okay. So if it gets better, if you have a bigger radial displacement,
Yeah.
you have improvement.
It's supposed to be correlated with decrease of spasticity because the muscle is more relaxed. But if it was, for example, in another patient with no spasticity, with a weak muscle, it increased, it would be bad because it's correlated with weakness. So it depends, but in this case, with the spasticity, an increase is good.
And then the colors that you have, the red and blue and green. The green is the follow-up, right?
Yeah.
So if it goes up in the follow-up, it means that you had improvement.
Yeah.
And you have TB, is it?
Triceps brachii.
Oh.
This is TB is triceps brachii. Triceps.
Okay.
So this is not allowing any causal relationship because this was only a clinical a case study, just to say, okay, we are feeling this in the clinical setting. We are going to know if this machine is measuring something. So we have used 2 machines, a myoton, which is giving the passive properties, and this tensiomeography, which is giving the active properties. So we are just checking what's happening and if this has any correlation. So if they can be useful, we want to develop further studies with a bigger sample. But for example, with this machine, the problem is that it's not very portable, it's very difficult to handle. So perhaps now we are working with myotone because it measures the passive properties, but it's very portable, so, and it's very reliable. So this is only like giving you an idea of what we find in the clinical setting, and sometimes we see different behavior of the muscles, although we can say this is the real thing happening because it's only one case.
And for the follow-up after 3 or 4 sessions, do you think that's enough, or your patient should come back with something?
It's a follow-up after 3 weeks, but only with 1 session of dry needling. So the patient comes, we made a pre and post measurement, and then he comes again after 21 days without doing other dry needling, and the patient shows that. Another thing that we should consider here is to standardize all the measurements, and which is the reliability of this equipment also, because there are a lot of things that we can consider, but this is the only way to measure. This is the best technology that exists today to measure these things. So we try to evaluate if it was the same like in sports people, trying to measure changes. So for us, the more reliable is the pre-post, but because when it goes about 21 days, there are a lot of things that can be influencing this kind of patients.
If you can hold the rest of your questions for the break, but you can ask them personally, because for time's sake, we'd like to move on, if you don't mind. And Pablo will be here for the rest of the day, so I'm sure you can grab him again if you need to. Thank you very much.
Okay, thank you.